We've all heard the promise. Chronic stress is a direct ticket to a heart attack, and sitting quietly on a cushion prevents one. But how exactly does an invisible thought inside your head physically calcify into a blocked coronary artery? To find out, we have to test this myth using a framework called the claim ladder. We need to track the evidence down through 5 specific biological tiers: perceived stress, hormones, biomarkers, plaque, and finally, hard clinical events. Accepting that feeling less stressed means you're reversing heart disease skips 4 rungs of that ladder. It's a scientific leap of faith. To know if meditation actually protects your heart, we have to track the biology all the way down to the artery itself. Starting at the top rung, the clinical evidence is clear. Structured mindfulness and meditation programs successfully reduce perceived psychological stress, calming the threat processing circuitry in the brain. This brings us to the second rung, hormones, and a very common misunderstanding. The popular assumption is that chronic stress constantly pumps high levels of cortisol into your blood, and that meditation cures us by simply lowering that volume. But this chart shows what is actually happening. A healthy cortisol system follows a steep circadian rhythm, peaking in the morning and dropping low at night. Chronic stress doesn't necessarily mean high cortisol. It causes HPA-axis dysregulation. The rhythm flattens out. It forgets how to spike and how to drop. At the same time, the target tissues stop listening. Through a process called glucocorticoid receptor resistance, chronically stressed immune cells actually lock their doors. They reject normal cortisol signals entirely, keeping your system inflamed even if your hormone levels read as perfectly normal. Because chronic stress damages receptor sensitivity and timing rather than simply raising the volume, the idea that meditation can uniformly normalize this system is incredibly difficult to prove. For the general public, that benefit remains largely unverified. So if cortisol isn't the primary culprit, what is? We move down to the third rung, biomarkers. Research points to a specific chain reaction called the amygdala-marrow-artery axis. When the brain's threat center, the amygdala, is chronically active, it sends a direct signal into your bone marrow. The marrow responds by overproducing white blood cells, which flood into the bloodstream and physically embed themselves into the walls of your arteries, driving local inflammation. We know stress triggers this cascade, and it also drives up blood pressure by tightening blood vessels over time. So how well does meditation counteract these systemic changes? This graphic illustrates the benchmark 2024 Cochrane Review, which analyzed 81 randomized trials with nearly 7,000 participants. They found that against an active control group, transcendental meditation provided exactly a 2.33 millimeter of mercury reduction in systolic blood pressure. A 2-point drop is biologically real, and it is certainly helpful for overall health. But it is a minor statistical assist. It does not possess the sheer mechanical force required to single-handedly stop cardiovascular disease. Now we step down to the final 2 rungs of our ladder, plaque and heart events, the ultimate test. Does a mindfulness practice physically shrink structural plaque or stop a heart attack from happening? Direct evidence for plaque reduction is effectively 0. A rigorous trial conducted over 14 years tracked the thickness of carotid arteries in high-risk patients. Between the group that meditated and the control group, there was absolutely no difference in plaque progression. A few isolated studies do claim a significant reduction in fatal cardiac events. However, these trials originated from researchers with deep institutional ties to the organizations licensing the meditation techniques. Despite calls from the American Heart Association, those specific findings have completely failed to be independently replicated. The chain of evidence snaps at the most critical point. While the psychological comfort and modest biomarker shifts are well documented, they simply do not statistically translate into verified protection against clinical heart attacks. The epidemiological data suggests chronic stress increases the relative probability of an event by roughly 1.2 to 1.3 times. It is a risk modifier, not the foundational cause of the disease itself. To build an atherosclerotic plaque, your body strictly requires a substrate, ApoB-containing lipoproteins, which carry cholesterol. If ApoB particles are getting trapped inside the vessel wall, the plaque will grow. Psychological stress simply modifies how fast that pre-existing biological process runs. Unlike a meditation retreat, the therapies prescribed in a clinical setting, like ApoB-lowering statins or targeted antihypertensives, have been subjected to objective physiological testing that definitively proves they prevent arteries from closing. This brings us to the substitution error. The single most dangerous outcome of the wellness narrative is when a patient abandons proven, guideline-directed medical therapies in favor of just managing their stress. Meditation is a valuable low-risk tool for behavioral regulation and finding peace of mind, but the physical anatomy of preventing a heart attack demands guideline-directed medical science.